Hello, today we're going to talk about managing rheumatoid arthritis flares. And really, while we're going to call it and talk about rheumatoid arthritis, we're really talking about how to manage any type of flare caused by any form of chronic inflammatory arthritis. Specifically, rheumatoid arthritis, as a brief reminder, rheumatoid arthritis is an autoimmune inflammatory form of arthritis. It causes pain, stiffness, and swelling within joints. It affects about 1% of the population, but more commonly women than men. There is still no cure for rheumatoid arthritis, but there is excellent treatment options, meaning our goal is no pain, no stiffness, no swelling, and essentially a normal life. And we do that with a class of medications called DMARDs, which stands for disease-modifying anti-rheumatic drugs. We're not going to talk about them much here. We have lots of other videos if you'd like to learn more about DMARDs, or you can visit our website. So what's a flare? A rheumatoid arthritis flare is when your rheumatoid arthritis, which was previously controlled, becomes active for some amount of time. Usually there are symptoms associated with that flare. So you might feel more pain or stiffness. You might see swelling within a joint or joints. It may manifest as fatigue and low energy. And it could be any one of those things. It can be all of those things. A flare may happen whenever it happens. It can often be unpredictable, although there are individuals who can feel or predict when that flare might be happening. And a flare can vary in length. It could be a day or two. It could be a few weeks. And they can vary in frequency, happening once a month, twice a month, 3 times a month, to for a day or two, once every few years. There's not a particular way that a flare must happen. But when they happen, we want strategies to deal with them. And we want to talk about managing a flare in different categories. So there's short-term flares, a day or two, long-term flares, where we probably are talking about a couple of weeks, if not more. And of course, we don't want the flare to happen in the first place. What can we do to prevent those flares? The other thing we want to think about for a flare is, can we identify a cause? In a lot of cases, we can't. That's probably more normal than not. But for some people, they know that when they do this, or when they eat that, or when something happens, that's more likely when a flare is going to happen. The cause of flare may be associated with treatment, usually maybe pulling back on treatment, or changing how you treat. And the other thing to always keep in mind with a flare is it truly a rheumatoid arthritis flare, or maybe is it something else? So sometimes a rheumatoid arthritis flare can feel like a cold. Maybe it is a cold, or maybe there's something else going on. So while we want to ensure we are managing rheumatoid arthritis flares properly, we also don't want to mistake it for something else that we can manage in some other way and make you feel better in that other way. So how do we manage these flares? So in the short term, with the hope that things really settle over a day or two, it's really around adaptation. So adapting your schedule of tasks when it's harder to do. Can you change your day-to-day task for a day or two to pull back a little bit so you're not overexerting yourself and causing more pain and discomfort? Are there support systems in place where you can ask for help and feel comfortable asking for help? Sometimes that means having those conversations in advance to explain to people that you have this form of arthritis. It's a different form of arthritis, and you might need their help, or you may not be able to meet expectations for a day or two or a bit more because your disease may be active. That's, I think, really important conversations to have with immediate family, but may be important conversations to have with others that you feel comfortable with having those conversations. Sometimes having assistive devices around can be helpful. So for walking, whether it's a cane or something like that, there are devices to help open jars. There's lots of devices out there that can be helpful. And if you're not sure, sometimes it's about, again, pre-planning. And if you're in a flare, to have conversation with an occupational therapist in advance to say, what can I do during those times? What kind of devices are out there? So you are informed and have that knowledge of what best to do in those situations for you. Rest is important. Feel okay that if you want to sleep a little bit more, that's okay. We don't want to stop entirely if we don't have to during a flare, but we also don't want to cause more pain and more discomfort. So we only do what we can do, and then we're okay with anything just to stop at that stage. You want to try to manage stress. That's a challenge for everyone in life, but perhaps even more important during this time to realize that during a flare, you don't have the control that we all feel like we have, and that's okay, and that things will pass, and things can get better. And sometimes having someone to talk to around how you're feeling in those times can be really helpful as well. All those things have nothing to do with taking a medicine, and that may be enough. But for some people, having medication options can be useful. So in short-term flares, we're talking about medications which help the symptom of pain and stiffness. For a lot of people, that's anti-inflammatories or NSAIDs, things over the counter like ibuprofen or naproxen, and there's a lot of brand name options for those as well. You should talk with your rheumatology team to make sure those are safe for you to take and how best to take them. And your rheumatology team may be able to prescribe a anti-inflammatory for you so you have it on hand in case you need it. Sometimes prednisone, a very strong anti-inflammatory, which has to be prescribed, could be appropriate. But again, that's a conversation to have with your rheumatologist and rheumatology team. Natural health products may have a role. For a lot of folks, they probably don't have a lot of benefit for an acute short-term flare. But if it works for you, and as long as it's not interacting with any other medications, that's not a problem to certainly try. And if it helps you, that's fantastic. On our website, we do have a database of natural health products commonly used on arthritis. And if you want to take a look there to look for benefit and safety, please feel free to do that. Or of course, again, always talk to your rheumatology team. I've used that term a lot here, talk to your rheumatology team, because the best thing that you can do for a short-term flare is be prepared for it. Talk to your team, work with your team, so you have all these strategies in place beforehand. And hopefully you don't need them because you won't have a flare. But if you do, you're prepared and know the right things to do for you that's going to work. So that's a short-term flare. A long-term flare is more that the disease is active and not settling on its own. It's debatable if you would actually call this a flare or just the disease is active now. The arthritis is active. Similar, maybe not as severe, I hope, but similar to before, where there is persistent and longer-term pain, stiffness, swelling. This really needs a conversation with your rheumatologist and rheumatology team to react to it. So in addition to using the strategies we just talked about in terms of a short-term flare, we probably at this stage want to consider a change in our long-term medication regimen, our disease-modifying antiemetic drugs, so we gain better control of the disease. And after a couple weeks of being in flare, it's not unreasonable to talk to your rheumatologist or your rheumatology team to discuss what's the optimal timing to look at when that change needs to happen. And for everyone, that's going to be a little bit different in terms of what medications you're on, how long you've been on them, and kind of your treatment course over the course of your arthritis as well. But a really important conversation to have. Now, ideally, we prevent flares in the first place. So what are strategies that we can always be considering to prevent flares? So perhaps it goes without saying, optimal disease control is going to prevent flares. If we have our condition under really good control, it probably means there's less chance of a flare. So if you're having 2, 3, 4 10 flares a year, they're not too bothersome, but they're happening frequently enough, it's important to let your team know, because maybe there's a role to adjust your disease-modifying agents a little bit to prevent those flares from happening, which then hopefully reduces your risk of a more significant flare from happening in the future. Optimal disease control means you don't need to take anything for pain, and you're not limited in your day-to-day activities. Really kind of that quote-unquote normal state. What are some other things that we can do? So if you're a smoker, it's never too late to cut back or to stop. There is excellent data to show that smoking makes your arthritis more active, and it makes your treatment for arthritis less effective. So if you're able to cut back or stop smoking, it means that your arthritis may improve a little bit on its own, but it also probably makes the medications that you're on more effective without needing to change them or increase dose and that sort of thing. In other words, decreases your chance of flare. Weight control can play a role. Certainly, the more ideal your body weight is, the more effective medications may be for you, and the easier your body is on your joints as well. Similarly, exercise is a good thing. Exercise during a flare, not suggesting that, but in between flares, keeping your joints healthy and keeping the muscles strong around joints is only a good thing, and it does actually help reduce pain. A lack of activity and less muscle mass around joints probably predisposes to a little bit more pain than someone who isn't active. Dental hygiene, surprisingly, can be very important. So there's growing data that having good dental hygiene, not a lot of cavities and not a lot of kind of bugs in your mouth and things that can be going on there, can help reduce your disease activity. And the converse is true as well, that if things are more active in your mouth and with your teeth and that sort of thing, that might not help your arthritis. So seeing your dentist and making sure things are as optimally controlled there can be really helpful. Stress management, we talked about this before during a short-term flare, but certainly in terms of flare prevention. While the data on the association between stress and flares is not particularly strong, we certainly see this, that one's going to play off the other. And the more that we're able to have a balance in life, overall, that's good for our health and wellness. Infections certainly can play a role for flares, but not necessarily that's a given. Colds and flus and all these sorts of things that we normally get, we're going to get when we have arthritis as well. And for most part, they are not going to increase your risk to have a flare. But for some folks, that can play a role, and we want to minimize that. And as I said throughout, work with your rheumatology team. Ask your team questions of how you can best optimize flare prevention. Make sure you have strategies for their short-term flares, and make sure you know how to reach out to your team if that flare is becoming a little bit longer, more worrisome, so we can do a better job of getting your arthritis under good control and back fully in remission. For more information on rheumatoid arthritis, on any form of arthritis, on any of the treatment options we've talked about, please feel free to watch any of our other videos or follow us on our website at albertarheumatology.com.